Namaste, my name is Dr. Kumar Rishikesh and I am consultant medical oncologist at Indraprastha Apollo Hospital, New Delhi. As you are aware that Breast Cancer Awareness Month is going on. This is the month of October, so it is very important for every one of us to be aware about this disease and help the society save as much as life we can. So how you can save, how you can help in this? One of the important steps to save the lives in cases of breast cancer is screening. So every woman more than 40 years of age needs to undergo breast cancer screening, and it becomes more important for the early screening if there are certain risk factors. So like average risk woman, that means having no personal history of breast cancer, no family history, especially the first degree relative having the history of breast cancer, no genetic mutation like BRCA1 and 2, either with the person or the family first degree relative, and any congenital syndrome. There are certain congenital syndromes which also increases the risk of breast cancer. So if these are not present, the person would come under the average risk, and in that case the screening should ideally begin at the age of 40. However, because of the dense breast, 44 sometimes become ideal time to start this screening. So what is the method for the screening for the breast cancer? The first and foremost would be the mammogram, annual mammogram of the bilateral breast, and this gives us a lot of information. Though despite doing the mammogram, you may still miss some of the person who are having the breast cancer. So there are other methods also, like adding MRI of the breast to diagnose more cases. So my recommendation in this month would be to make aware all the persons around you, especially all the persons around you, your family, your friends, that the women should undergo breast cancer screening if she is approaching that age group. The question also arises, how long the breast cancer screening should be done? Ideally, if a person has a expected survival of more than 10 years, or you can say that women should undergo breast cancer screening till she has expected survival of more than 10 years. And I would also suggest those persons who are on high risk of breast cancer, like having personal history of breast cancer, first degree relatives suffering from the breast cancer, genetic mutations related to the breast cancer. So these women should undergo or start breast cancer screening at the age of 30 years. So this is my message for all the women regarding on the occasion of this Breast Cancer Awareness Month, and I would strongly recommend that you must do breast self-examination and also clinical breast examination when needed. So this would be clinical breast examination is important, and for the breast cancer, there are certain signs which tells you that yes, this may be you need medical intervention, like if you feel that there is swelling in the breast, if you feel that the position of the areola or nipple has changed, if you feel that the skin over the breast has some unusual appearance even without underlying swelling, and if you have lymph nodes in and around the breast like axilla, above the collarbone, then you should visit your oncologist. Thank you.